Hello, my name is Ian McCall. I'm one of the authors and presenters of the Certificate of Skin Cancer Histopathology that's presented by SCANS, by the Australian Institute of Dermatology, and by the Melanoma Signature Group. We are three of us. That's me. This is Cliff Rosendahl, who has produced a lot of these slides and a lot of the material. And this is Ian Katz, a specialist pathologist. I'm a dermatologist with an interest in histopathology and the education officer for the Australian Dermpath Society. So what's the Certificate in Skin Cancer Histopathology all about? Well, first of all, it's going to be an online weekend meeting. It's going to be a series of lectures, and they're going to be interactive. If you're taking part in this, you'll be able to ask questions of the presenters. You'll be able to put your hand up at any point, and we'll take your question and try and discuss it. So we're going to make this a very interactive way of teaching you the relevant dermatopathology related to skin cancer. It's an area that really hasn't been covered terribly well, and we know from our work on the Skin Cancer College blog that it's an area some people feel very weak in. So we decided about 6 months ago to put this course together, and the majority of the work has been done by this man, Cliff Rosendahl. Cliff is a genius in his ability to grasp a topic and put things into practice. Let me just enlarge this slide to show you some of the things he put together. First of all, this is a lovely microscope. Attached to it is I think it's a Canon D50, and through this we can take slides of any cases that we can project them on the screen. Cliff has, I think he's got a series now for about 400 consecutive cases of skin cancer that he's seen, where not only does he have the dermatoscopic images, but he has the histopath images and the clinical images. So it's an immense resource of material that he has. And he's been able to put it together to give us a series of presentations that I think you'll find very interesting. Let's go back and just swiftly go through. I'm not going to enlarge any of these other images. This is just a little introduction. It shows you the way in which we'll teach. And, this recording is similar to the recordings that will be done of the lectures that are given those weekends. And they'll be available for you to peruse afterwards. There's also a very instructive pre-course section that we've put together to allow you to come to grips early with all the terminology that's involved in this new field. I've made some videos of it. Most of the material, again, has been material that Cliff's put together, and I think there's about 350, 380 slides, even in the pre-course material. So the actual course itself is going to extend over a Saturday and Sunday, and be somewhere in the region of 8 to 10 hours of interactive work that we'll do. Doing it online is an innovative way of doing it. We're very used to running these webinars. The advantage is we can keep the costs down. You can see things on your own monitor at home, and many of the things we're going to show are actually much better seen in a monitor close-up rather than in a lecture theatre where you're 60, 70 feet away from the screen or more, and you can't see the finer points clearly. You'll see everything in great clarity when we present it in this way. These are some of the resources that we're going to use. There is a new book out, Cancer of the Skin, 2nd edition by Rigel, that I think is very good as well, but I'll go into detail in that in the pre-course videos. This is the course outline, what we're going to try to give you. Clinical histological correlation is something that I'll start off with, basically looking at what you see just clinically and seeing what histological information you can glean just from looking carefully at lesions in a clinical sense. We'll give you detailed lectures on introduction to dermatopathology and the like, detailed lectures on histological diagnosis of non-melanocytic and melanocytic lesions. And this will be Cliff's pièce de résistance, where he'll give you a superb lecture on dermatoscopic histological correlation. And those of you who enjoy dermatoscopy will really enjoy this. And then we'll do a thing on dermatopath dilemmas, case presentations with a great deal of interaction. So you can go over what the objectives are that we're looking for and this pre-course presentation. Some of the lectures, some of the material that follows is just some extracts from this pre-course study material. We look at the structure of the skin, go through some of the terminology that you've got to be aware of before you actually come along. You get so much more out of the lectures if you do the pre-course material and go through it all carefully. Get up to speed with the terminology that's used, and it's all beautifully illustrated in the pre-course material. These are some of the material that Cliff has presented. We'll go into Breslow thickness and all the other various features that are associated with a melanoma diagnosis and the histopath report. At the end of all of this, we want you to be able to read a histopath report and see in your mind's eye what the histology is. You should be able to translate words into pictures and actually be able to visualize what that histoslide will show. Now, if you've got a microscope yourself, you can ask for histoslides from the cases that you, in fact, present to your pathologist, and they're very happy to do copy slides for you. We're also looking, or at least I'm looking, at some ways of trying to look at histoslides without needing a microscope. Now, bear with me with that. I'm still in the early phases of looking at this, but I think I've got a method that you'll find quite useful, and I'll bring that into the main lectures of the pre-course section. You can see the quality of the slides that are produced are really excellent. We'll detail all the various informational stains that are used so that you know a little bit about the special stains that are sometimes asked for melanocytic and non-melanocytic lesions. Go into these brown stains or immunoperoxidase stains. I mean, obviously that's not a major thing for you to know, to be able to carry out good skin cancer practice, but at least you understand what the pathologist is doing. If he's saying, look, there's a delay in the diagnosis here, I've got to do special stains, you understand why he's doing them, what it is he's looking for. Most of the material we're going to give you isn't going to be, you know, really detailed stuff on this. It's going to be bread and butter stuff on the histology of the common skin cancers that you see, so that you can understand why certain treatments can be done for certain cancers, why certain margins are necessary, just from the growth pattern of these lesions that you see histopathologically. There's a big section on the non-melanocytic tumors, you know, all these lesions here that are really keratinocytic proliferations, but often with excess melanin in them, making them dark. There's also these other adnexal tumors, Merkel cell carcinomas, atypical fibroxanthomas. Sure, you're not going to see a lot of those, but it's nice to have looked at the histology of them. You'll have seen them clinically in some of the blog cases that we've presented, and I think it's good if you know what the histopathology looks like as well. We'll go into all the various subtypes of BCC, which is what you'd expect us to do, with some excellent images. Look at the quality of these. You can expand these yourself when you look down this presentation in your own time. But they've been beautifully put together, and they're amongst the best histopath slides combined with clinical images and dermatoscopic images that I think I've ever seen. And I've seen some good ones. But these are excellent. Now, you can see this is an infiltrating BCC, a morpheic BCC. I'll deal in quite some detail with clinical images and what you can infer from them. But this is the infiltrating picture you see of BCC in an infiltrating BCC. Little bits of atypical fibroxanthomas, some special stains that are done sometimes to show keratin in the stratum corneum and in the epidermis here. And sometimes to show melanocytes, an S100 stain showing the little brown melanocytes along the base of the epidermis here. Then we're going to have a little look at some of the other non-melanocytic tumors that we'll cover. So we'll cover all of these, looking at the histology of all these lesions. Now, I'm sure many of you have obviously cut off these before, and so you'll become acquainted with what the histopathology of these looks like. Then we'll look at all the melanocytic lesions, those where there's proliferation of melanocytes, and go into the lentigo simplexes, the various types of nevi, including the blue, the spitz, the reed nevus. Then discussions of Clark nevus and the term dysplastic. This is used a lot. There's a lot of controversy about it. Well, we'll try and give you an understanding of what that controversy is all about so that you can discuss it yourself with your pathologist from a position of strength and understanding. We'll look at the reed nevus, we'll look at spitz nevi, and there this big issue of melanoma versus nevus. What is it the pathologist is looking for? What sort of specimen do you have to present him so that he's got all the information he needs? We'll certainly go into all the various types of melanomas with some marvelous images. These are the other things that we'll look at. And then Cliff's proverbial dog with a bone. Basically, he'll gnaw away at something if he feels that dermatoscopically it's something and the pathologist thinks it's something else. He's prepared to back himself most of the time, and generally he's right. And he's shown many examples of that in the Skin Cancer College's blog. And there'll be a lot of cases that will be well illustrated. All the clinical stuff, because you still have to have clinical. We're going to emphasize aspects of the clinical features of cases. It's not all going to be histological images. You've got to relate what you're seeing down a microscope, but relate it to what you're seeing clinically and what you're looking at down a dermatoscope as well. So we'll certainly always be emphasizing that sort of correlation as we go through this. At the end of all of this, you should be able to look, as I say, at a histopathology report and translate all the terms into visual images and be able to see in your mind's eye what that histopath image is going to look at if you had the slide there and were looking at it under a microscope. So that's essentially what this course is going to be about. It will be interactive. All the lectures will be recorded so that if you miss one or you have to go away for part of it, you'll be able to see this afterwards. And we also hope to run perhaps a few monthly webinars, meetings afterwards on cases that we've in fact seen. If you've got some good ones, you can send them in to us and we can put them up just to consolidate your learning over the next few months after the certificate course. So I hope that's whetted your appetite. I hope you've appreciate why this sort of course is important and what it is that we have to offer you. And from the three of us, we hope we're going to see you in the course itself in, I think it's the 12th and 13th of November, the Saturday and Sunday. Hope to see you there. Thank you very much. Bye-bye.